Thursday morning, 8:13. That's the time we talk to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. Good morning, Dr. Brent. How are you?
Hey, Tommy. I'm doing good.
Good to have you. I hope you like the cold weather, or do you?
Yeah, I know you like it. I could use a little sunshine, actually.
Man, I'm telling you, I don't know if I have seasonal affective disorder or what, but I love this kind of weather. For the audience, I know, Doc, you know this, but did you know that brushing, flossing, and this is really not just for senior health, this is for everybody. Did you know that brushing, flossing, and regular visits to the dentist can protect you from more than cavities? Well, Dr. B is here from People's Health to explain the connection between oral health and the rest of your body, plus give us some good tips for oral hygiene. So first of all, Doc, I guess, how does oral health affect our overall health?
Sure. You know, a lot of people kind of think of their mouth as completely separate from the rest of their body. You know, that might be because you go to a dentist instead of your primary care doctor, or maybe because your dental insurance is completely separate from your health insurance. But actually, you know, the mouth is really an integral part of everything going on inside of you. It offers a lot of insight into really the overall health of a person. And, you know, it's important to keep in mind that the mouth has bacteria, just like other parts of your body. You know, but when you have really good oral health and you're brushing daily and flossing, then usually your body's natural defenses will keep that bacteria under control. But if you don't do that, then sometimes that bacteria can reach higher levels, unsafe levels, and that's what leads to things like tooth decay or even gum disease. And then the other thing that's really important to think about is your mouth is really the entry point to your digestive system and your respiratory system. So if you get uncontrolled bacteria in the mouth, that can actually lead to a lot of health problems. It can enter the bloodstream and actually cause infections throughout your body. Or, you know, one thing we see quite often is bacteria from your mouth can be pulled into your lungs, and that can lead to something like pneumonia.
Wow, you know, I realize as you say that, the first thing doctor does when he examines you, what, is says open your mouth and say, right?
Yeah, we're always taking a look in there because, like I said, it gives you insight into what else might be going on.
Kind of like opening the hood. How else are oral health and medical health connected?
Well, I mean, both are really heavily impacted by your diet, and that's why diet's so critical. You know, if you have a greater chance of having tooth decay if you eat high amounts of sugar, much like you have a higher risk of diabetes being out of control if you eat too much sugar. So, you know, so drinking soft drinks or sweet tea, pastries, all the things we really love, those can cause a lot of problems down the road. You want to make sure your diet has a lot of essential nutrients, because that actually makes it easier for the tissues in your mouth to fight off infections. And if you don't fight off those infections, that can lead to gum disease and really other problems like tooth decay. You know, so when your gums hurt, the other thing to think about is it's harder to eat those good-for-you healthy foods, things like apples. You can't eat if you've got a lot of gum disease or tooth decay. So a healthy diet really improves your overall oral health, but also the health of the rest of your body. You know, a great diet, like we say all the time, can give you a lot of energy. It helps you fight off illnesses and really reduces your risk for chronic medical problems. So, you know, we always tell people eat a good, nutritious diet, drink plenty of water. You want to make sure you have lots of fruits and vegetables and lean meats. And really high calcium foods are critical to oral health as well, things like salmon and low-fat yogurt. It's really a good investment, you know, for your oral health, but your overall body health as well.
What are some of the signs of poor oral hygiene?
Yeah, so people definitely have experienced this. They probably had friends and family that have had this, but one of the biggest things we see is bad breath. You know, the medical term for that is halitosis, and that can be a sign of bacterial overgrowth. And then, like I mentioned, gum disease is very common. So red inflamed gums or even bleeding gums, especially after you brush your teeth or floss, that's a sign of something going on. Frequent toothaches are not normal, and so you need to get those checked out. And then sensitivity, in particular to hot and cold beverages, can be a sign of something going on. So if you have any of those signs, you want to talk to your dentist about those. Go see your dentist and make sure that you're taking care of your oral health.
What are some common oral health diseases, things we got to worry about?
Yeah, so there's really two major things that we look at. The first is tooth decay. It's really the most common oral health condition, and that occurs when plaque forms on the surface of your teeth, and it actually can overgrow because of the acids that are created by the sugars that we eat over time, and that actually can lead to actual decay of the tooth. That can cause pain, infection, or even tooth loss. And then the second most common is gingivitis, or that's really inflammation of the gums themselves. So that gum disease can cause a lot of irritation, redness, even swelling of your gums, and that's going to make it difficult to eat in general. So if it's left untreated, that can actually lead to really severe gum disease that can result in tooth loss as well.
How can we improve our dental health?
Yeah, it's pretty simple, and probably your mom's been telling you this since you were little. Brush your teeth. That's one of the most important things.
That toothbrush better be wet, young man.
Yeah, I know. We always snuck into bed before brushing our teeth, but really it is critical at least twice a day, at least 2 minutes each time you brush. And you want to use a soft bristle brush, with toothpaste, absolutely. And then flossing is very important, and a lot of people don't like to do this. They sometimes use floss picks, which are not as good as just regular dental floss. But that's really to kind of get the plaque out from in between your teeth. And then typically we recommend that people use an antiseptic mouthwash afterwards to remove any of those food particles. And then I can't say it enough, eating a healthy diet is really critical. You want to keep the sugars low. You really want to avoid tobacco altogether, and then limit your alcohol consumption, because both alcohol and tobacco are greatly associated with gum disease or mouth sores and definitely tooth decay. So, in addition to the chronic health conditions that they cause. And then the other thing to always remember is get your checkups. It's just like going to see your primary care physician. It's critical to see your dentist really at least annually for a professional cleaning. They're going to get in there and get things you couldn't possibly get with your own toothbrush, remove the tartar, and actually check your mouth out to make sure that everything is healthy.
If I may add, Doc, my ex-wife was a dental hygienist, and I know that if you use any of these tobacco products in your mouth, you're begging for oral cancer, are you not?
Absolutely, absolutely. That is directly related, and the dentist will be able to tell when they get in there exactly what's been going on.
I will take a break. When we come back, we'll pick it up here. We'll talk about some barriers, to good dental health. We're talking with Dr. B from People's Health. He's talking about the connection between oral health and the rest of your body and some tips for good oral hygiene. 821 traffic now, WWL. 826, Tommy Tucker, WWL. Quickly back to Dr. B, Dr. Brent Wallis of People's Health, as we discuss oral health and how it can affect your overall health. Doc, what are some barriers to good dental health?
Yeah, where you live, and in particular kind of lack of accessible transportation, in addition to really just a limited health knowledge, are all obstacles to receiving good dental care. But interestingly, what the American Dental Association says is that the most common barrier is really cost. Nearly half of all Americans who have dental insurance actually skip dental visits or any sort of recommended procedures because of the cost of it. And that number jumps dramatically, almost to 65% for people that do not have dental insurance.
Why do so many older adults not have dental coverage?
Yeah, so it's interesting. Original Medicare, we've talked about this before, really doesn't cover any routine dental services. So that means it's not going to cover things like cleanings, dentures, or tooth extractions. So if you want, if you're a senior and you want coverage for any of those services, you really have to purchase a separate insurance policy, a supplemental policy, or enroll in something like a Medicare Advantage plan that actually has a dental benefit. And depending on the plan you choose or the policy that you choose, that can still come with some pretty significant out-of-pocket costs.
Does People's Health offer a dental plan?
Yeah, actually we do, and all People's Health plans actually have a routine dental benefit, and we're very excited because in 2023 that benefit actually includes a $0 deductible and a $0 copay for all preventative and comprehensive dental services, and that's up to like a plan-specific amount that you can spend. But the covered services can include things like these exams and cleanings. It covers fillings, crowns, bridges, root canals, dentures even, and even implants. And so, really, it's important, like I said, to have this great dental coverage so you can make sure you're taking care of your dental health. You have with People's Health also access to one of the largest Medicare Advantage dental networks, so you can receive care pretty much throughout the state.
Doc, I got a text that comes in. Generally speaking, and everybody's different, I know, but if you're brushing your teeth and you're spitting blood into the bowl, you have an issue, correct?
Yeah, absolutely. Like I mentioned, that's probably a sign of gum disease or gingivitis, and so you want to get it checked out. If you're bleeding, it means you're breaking that gum barrier, and it's more likely that some of that bacteria can get into your bloodstream. So you got to go see your dentist for that.
Thank you, Doc. I know we're going to talk to you early next week because of Thanksgiving. Dr. Brent Wallis, have a great weekend. Dr. B, Chief Medical Officer of People's Health. Go Saints, right? Am I right?
Go Saints.
Go
we'll
Saints.
Do it this Sunday.
Yeah, I hope so. Write a prescription for the Saints to win. You go to peopleshealth.com to find out more about People's Health. You can visit the People's Health Medicare Center, 3017 Vets in Metairie. That's next to Party City. Appointments are recommended, but walk-ins are welcome, and you don't have to buy People's Health. They'll just take the time to walk you through the whole Medicare process. You can call 1-800-978-9765, and, of course, you can follow People's Health on Facebook, Twitter, and Instagram. When we come back, the one, the only Deuce McAllister to talk about the Saints. Right now it's time for WWL First News. And for that, we go to Dave Cohen.